PSA screenings.
Yeah.
There's a lot of controversy. There still is a lot of controversy about PSA screenings. What is your take on PSA screenings and when a man should get screened?
Sure. So PSA screening has been a complicated and controversial topic for some time. PSA is a blood test that measures a protein that's made by prostate and prostate cancer cells, so it's not a cancer-specific test. That's one of the things that makes it complicated. It is the best test that we have available today to detect prostate cancer early, and we know that when detected early, prostate cancer can be cured with appropriate treatment. So that's the rationale for pursuing that. We also know that many prostate cancers can be slow-growing, indolent, and sometimes don't need to be treated. And if we're too aggressive about detecting cancer early and treating it, we're going to put some men through treatment that they don't need and cause some harm. That's the balance that we're trying to strike with recommendations for PSA screening. In general, men over the age of 55 can benefit from PSA testing, but they need to understand the risks and the benefits of screening as they embark upon that decision. And a part of what I think is very important going into that testing is the understanding that the diagnosis may not need to equal immediate treatment. If we can uncouple diagnosis from treatment and watch some men that we think have very small and slow-growing cancers, we can reduce the harms and capture the benefits of screening. And we really need to be talking to patients about that, or to men about that, before we get the test. Once the test has been obtained, there's an abnormality, the mind starts racing, things start happening quickly. It's hard to slow down and think about those things if we haven't introduced those topics up front. So in general, I would say over the age of 55, with an understanding of what an abnormal test might imply. Now, there are men who are much younger who get prostate cancer, who have a family history, who may have other risk factors. So that general recommendation needs to be adjusted if you have a family history of someone who's been diagnosed with prostate cancer at a very young age, or may have a predisposing genetic abnormality for prostate cancer or other risk factors.